All right, well, why don't we get started? It looks like the number of folks that are adding to the call is starting to slow down a little bit. So welcome everyone to the Hamilton Health Sciences Town Hall for today, November 7th. Thanks for finding some time in your day for some important conversations to be had today. I think with that, I will turn it over to our CEO, Rob McIsaac, to formally kick things off. So over to you, Rob.
Yeah, thanks very much, Dave. Good morning, everybody, and thanks for joining us. As we begin, I'd like to acknowledge that we are privileged to provide care on lands that Indigenous peoples have called home for thousands of years. HHS recognizes and respects the presence and stewardship of all Indigenous peoples as keepers of this land. A couple of other acknowledgements to really get us started today. I'd like to mention that tomorrow, November 8th, is Indigenous Veterans Day. The military contributions of First Nations, Inuit, and Métis often are not recognized or historically have not been. Tomorrow marks an important opportunity to celebrate our Indigenous veterans who have served in Canada and around the world, both in times of war and peace. Of course, also this week is Remembrance Day, and when we pause to reflect on the service of all Canada's veterans and their efforts to maintain freedom in our country, you can find more information about both observances on the Hub, and I would encourage you to spend some time reviewing that. So again, thanks for making time for this special town hall today. You can see our agenda laid out there in 4 steps. So we are going to start with an operations update, as is our custom. And I'm going to turn it over to Sharon Pearson, our COO, to provide an overview of the state of HHS's operations. Sharon, over to you.
Great. Thank you, Rob, and good morning, everyone, and glad to be here today to offer you an update on our sites. As usual, we'll start with our COVID numbers, which unfortunately we do see continue to rise. Today, we have 127 COVID patients. For a bit of context, 2 weeks ago on October 25th, we had 91. So we just incrementally go up 1 or 2 per day. Fewer patients in ICU than our previous waves that we've seen. Right now, we have fewer than 5 COVID patients in our ICUs, but we are seeing a bit of a rise in our outbreaks. So we have 5 as of today, and we have 183 staff in self-isolation. So those numbers also continue to rise, unfortunately. If we go on to the next slide, the resultant impact you can see in continued stresses across all of our acute sites and our post-acute sites. So overall, our occupancy as of midnight last night was just shy of 100%. But you can see at an acute site level how intense the pressures are. And just to call out the McMaster site, the overall site occupancy is 112%, but the occupancy just in the PEDS portion of the beds is over 145%. So immense strain on that service right now, as we're seeing reflected across the province and the country. And I'm sure you're all following the media on the state of affairs in the various pediatric hospitals in our province. Our ALC numbers also continue to rise. So as of today, we have 248 ALC patients, remembering 120 of those would be in our satellite health facility. And on to the next slide. In terms of our surgical capacity, we do sit at 88%. Just a bit of context to that number, though, we have changed our pattern somewhat, and we're doing more same-day home, same-day overnight activity, an activity that does not require an inpatient bed. So we still have significant challenges in our surgical resources right now. In terms of our ED volumes, we remain just at our pre-COVID volumes for our adult emergency rooms, where we've seen a significant surge is in our children's volumes. As far as acuity, though, and length of stay, we do see that increasing across all of our sites. And as we've talked about previously, an immense amount of unfunded capacity open to try to offset the volumes that continue to come. And I mentioned our ALC rise. To put that in context, it's about 30% higher than we were this time last year. And on to the next slide. I just did want to talk about pediatrics a little bit more in terms of those occupancy pressures, very much enhanced in the ED and critical care areas, but would not understate the pressures that the inpatient areas and other areas of the pediatric services are feeling. We had to do a fairly substantive reduction in surgical activity to create the medicine bed capacity that we need across that site, and certainly working to augment the medical models along with the clinical staff models to keep up with those volumes. There was a communication out to the site looking for volunteers from ambulatory and other areas to support the inpatient areas and also from our adult sites. I know we're very stressed across our entire organization, but we're particularly stressed in pediatrics right now. So we are looking for individuals who have a previous working history or experience in the pediatrics that may be interested for a short-term secondment to the McMaster site, if we're able to do that from our sending sites at the adult hospitals. And we've also been working in partnership with our adult hospitals to see whether or not we can have our youth and adolescents cared for in our adults, inpatients, and ICU beds. And on to the next slide. In terms of other operational planning underway, we are anticipating a further surge in our volume, so we continue to plan to create capacity for that surge, be it related to the flu or be it related to COVID. We are augmenting our staffing models as best able, given the health human resource challenges we have right now. We continue to maintain our callback models for the registered nurses and the RRTs. And we're also looking at all of our care models and roles across the organization and ensuring we have contingency models in place as needed. We have tried to expand our post-acute bed capacity, certainly within the satellite, but also working with our community partners. And as far as our IMS structures, there's a cascading IMS infrastructure in place from the province to the region to Hamilton to our own local level structures that are in place and have been certainly active this weekend. We do have a new repatriation policy that will come into effect next week that will help us with flow that requires repatriation within 48 hours. So for HHS, that will be impactful because often we're the sending hospital and waiting for those beds in the community. And again, just ongoing collective planning for system stability with our partners across all of the sectors right now. So that's the state of affair with operations, and I'll hand it back over to Rob.
Thanks very much, Sharon. So obviously, the organization is under a lot of stress, and my thanks go out to all of you who are helping to see us through what is continuing to be a very difficult time in healthcare. Our community is relying on us, and people on the team are consistently rising to the occasion. I know it's difficult to say thank you enough for what's going on, and I hope it continues to mean something, because I can tell you the whole of the leadership team is very grateful to what everybody is doing, but I wish there was more that could be done, but the patients keep arriving, and all we can do is our best to try to help them. But I know it does put everybody under so much stress, which is on top of what's already been a very difficult 2+ year period. So thank you again. So the balance of our time today is dedicated to sharing with you the results of the Equity, Diversity, and Inclusion Assessment that was conducted earlier this year. If, as we're going through this, you wish to ask a question, I would encourage you to use the Q&A function at the bottom of your screen. That will allow us to review your question, and we'll make sure that one or more of the panelists responds to the question as quickly as possible. So many of you in the course of this process in EDI have been asked to participate in the assessment that will be presented to you today. The results from this assessment have been compiled into a final report that will also be made available today for everyone to review. We're also going to discuss how HHS plans to action the recommendations within the report and the broader work that's underway to develop an EDI plan for our hospital. I'll begin with some background on our EDI journey to date, and then I'll hand it over to a number of my colleagues who are going to speak in more detail about the assessment, the report, and where we're headed. So let me begin by saying something that I have been saying almost since I showed up at HHS, which is coming up for, well, 9+ years. Creating an environment where every person at Hamilton Health Sciences feels valued and respected, feels included, safe, is key to us achieving our vision of best care for all. We know, however, that many people who work for and visit our hospital experience racism, discrimination, and oppression. Maybe I'll just begin by saying on behalf of HHS, I apologize to anyone who has been subjected to racist, discriminatory, or oppressive behavior, and say I'm committed to changing this for the sake of everyone who works and receives care at our hospital. I think we all began to think differently about the reality of systemic racism in our communities and institutions over the course of the pandemic. Yes, there were a number of high-profile incidents in the media which contributed to this shift in people's thinking. Accordingly, I convened HHS's President's Advisory Council on Equity, Diversity, and Inclusion about 2 years ago. The council was comprised of people working at HHS, as well as patient advisors and community members with unique expertise in EDI. It was the first step of its kind that our hospital has ever undertaken, and it was overdue. The council was tasked with undertaking an assessment of our current state, and then also developing a set of recommendations around EDI at Hamilton Health Sciences, informed by stakeholder consultations. Now, as with any broad-reaching process, not every participant agreed with every decision made over the 18 months that were held. And I would say many of the meetings were difficult and painful for the people involved because of the subject matter that was being discussed. Having said that, I think the process was nonetheless valuable, and it marked an important beginning of our EDI journey. HHS was ultimately assisted in this work, by the EDI team at EY. EY is a leading international firm who helped summarize and organize the feedback that was received. I think the learnings gained through this assessment were captured in a report highlighting important ways in which EDI is not yet embedded in HHS's everyday culture. To discuss in detail this process and the key outcomes of the report, I'm very pleased to welcome Dr. Smita Halder, Dr. Sanjay Sharma, and Bruce Squires. They were the co-chairs of the Advisory Council. All three have been very gracious co-chairs and very committed to this work. And I'm really grateful for their leadership contributions. So Smita, Sanjay, and Bruce, over to you.
Good morning. Thanks, Rob, for the introduction. So on behalf of myself and my co-chairs, Dr. Sanjay Sharma and Bruce Squires, I really want to thank all of you for being here today. I also really want to acknowledge and thank the members of the President's Advisory Council for all their hard work and commitment over the many months they put forward to advance equity, diversity, and inclusion at HHS. The President's Advisory Council membership included a diverse mix of individuals with active and authentic connections to their respective communities. It included clinical and administrative members of the HHS workforce, patient experience advisors, and community members. And our mandate was to consult with folks across HHS and in the wider community to learn about their lived experiences, and then use what we learned to make recommendations about how to make HHS a more equitable, inclusive and diverse organisation. And as Rob mentioned, we did have support from the EDI team at Ernst & Young, and they helped us conduct an organisational assessment and then compile our findings in the report that's been released today. We recognise that the President's Advisory Council process was lengthy, and at times it let members down who thought it could have been structured differently or been broader in its reach. And I think this is evidence that we need to improve how we engage and consult around EDI moving forward. That said, I believe the report is a starting point, and continued engagement and input from the staff and the physicians, the patients and the families, and again, the wider community is going to be vital to informing HHS's EDI plan. So we're going to talk about some of the key themes and recommendations in the report today. And first, I'd like to share what the organisational assessment process entailed. So with support from EY, we spent 20 weeks engaging with a broad range of stakeholders. We conducted focus groups with staff and physicians and patient experience advisors. We heard directly from senior leadership in their leadership interviews, and we asked for feedback from everyone at HHS using the workforce survey. We also took a comprehensive look at HHS's policies and procedures using the Global Equity Standard Framework. And we spoke with representatives from 3 community groups: the Hamilton Anti-Racism Resource Centre, the Duarte Desney Aboriginal Health Centre, and the Hamilton Trans Health Coalition. Our goal was to hear from as many people as possible in order to make informed recommendations about EDI to HHS's senior leadership. And as you can see on the slide, that only a small percentage of the HHS workforce responded to the survey. So we know our process wasn't perfect, and that voices and experiences are missing from this final report. But it was still a valuable process, nevertheless. The feedback we received was powerful, and it helped illuminate some very clear themes and messages and recommended next steps for HHS. So my co-chair Bruce Squires will now take a moment to walk through what those key insights are. Thank you.
Thanks very much, Smita, and good morning, folks. Let me take this opportunity to also sincerely thank all of you who participated in any of the survey processes associated with this work, and in particular, the many of you who participated as members of the advisory committee. Certainly, Doctors Sharma and Halder and I were consistently impressed by the diligence and the passion of every member of the advisory council as you work through the process and develop the report. So many of you, I hope, will have now seen the summary of the report that was produced. I want to mention again that the goal as an organization was to use the information gathered to move beyond where we are now to where we want to be in the future on a continuous improvement path. It's not going to come as a surprise to I think to anyone that change really has to start at the highest levels at the top of the organization. The organizational assessment that we did revealed that senior leaders have such a big role to play in helping HHS to become more equitable, diverse, and an inclusive organization. And that starts with senior leaders knowing more about the issues that staff, patients, and community members are facing, and then committing to take action. That action has to include taking a look at all of the HHS's internal processes and policies with an EDI lens, and then removing those that are discriminatory, exclusionary, and/or problematic. As HHS, we also have some work to do to create new policies, new procedures, and clear statements about things like being anti-racist, trans-affirming, as well as our approach to Indigenous truth and reconciliation, to name but a few of the examples. Now, we also heard that many staff and many physicians do not feel like they have the training they need to provide culturally sensitive and inclusive care. That also needs to be rectified. And we need to look at how we can hire and promote more diverse staff and physicians in every single role across the organization to better reflect our community. These actions will decrease the barriers to care that marginalized patients experience and will improve the experience of our collective workforce. So you'll see that a significant number of employees surveyed reported that they don't have that sense of belonging to this organization. HHS must do more to foster an environment where all employees feel like they can be successful and be their authentic selves at the workplace. And last but not least, we learned throughout our process that we need greater transparency about things like hiring and promotion policies, procedures, practices, training. We also need a more explicit leadership commitment to help to build trust. Trust in the organization and in its leadership is what's necessary in order to move forward on our EDI journey. It's a necessary, certainly not sufficient, but a necessary start. So I'm now going to hand it back over to Rob so that we can continue to talk about what we now do with the report that was produced by the EDI Advisory Council. Thanks very much, Rob.
Okay, thanks, Smita and Bruce. And I know you were both speaking as well on behalf of Dr. Sharma, who was one of the co-chairs. I know that so much time and energy was put towards the PAC's work. And once again, I want to sincerely thank all of the members for their contributions, who I think have really laid the groundwork for what's to come. So on that note, I'm going to invite Rochelle Reed, who is our Senior Lead and Strategic Advisor on EDI, to discuss the development of our EDI plan and how the PAC recommendations will be put into action in the coming weeks, months, and years. Rochelle, over to you.
Thanks, Rob, and good morning, everyone. So before I begin, I just want to take a few moments to thank those who I've had the chance to connect with over the past 2 months since I've started in this role. You've all given me such a warm welcome to HHS, and I know that there are many of you who I haven't had the chance to connect with yet, but I am looking forward to making those connections over the coming months. So a few things for us to keep in mind as we move forward with the report rollout, keeping in mind that this journey that we are embarking on will be filled with lots of discomfort, hard and challenging conversations. So it's important that we remain engaged and committed to doing the work. You know, I know it will not be easy, but there is opportunity in the discomfort, and this is where the growth happens. So we must continue to lean into it. You will see that the report itself gives us a snapshot as to where we are at today, and it will be one of several inputs that will be used to frame where we want to be in the future. I also want to remind you all that we are in this together. I know that this journey will not be easy. It will not be a quick process, you know, and we may have missteps along the way, but please know that part of my role is to support you as we move forward. And I would ask for your support in return in helping to make our commitment to advancing our EDI efforts. Next slide, please. So in order for our EDI plan to be effective, we must acknowledge and address the challenges at hand. We have to acknowledge and address that some patients and some members of our workforce experience racism, discrimination, and oppression at HHS. These experiences cannot be tolerated and will require immediate attention and resolve. We must also commit to truth and reconciliation as an ongoing process, and we have to co-design a focused approach to Indigenous peoples, Indigenous health, Indigenous education, and Indigenous partnership. And as you know, EDI has been embedded in our overall corporate strategy, which prioritizes this work, not just for our board, but for the rest of the organization. Therefore, it will be appropriately resourced, measured, and reported on once we have a plan in place. The EDI plan will be a reflection of many inputs, including this report and additional recommendations from the President's Advisory Council. It will also reflect the Truth and Reconciliation calls to action, the various charters that HHS has signed on to, including the recently adopted Board Shift Inclusivity Charter, as well as provincial frameworks around EDI and anti-racism. The plan itself will also be a reflection of the many voices of our community, including our staff, physicians, patients, and the surrounding community of HHS. Next slide, please. So based on the report and the current climate, it is evident that there is a lot of work to be done. And we are committed to taking action to creating a safe, equitable, and inclusive environment for all. And this means committing to meaningful changes that have tangible outcomes for our patients, our workforce, and our community. In order to support this year, you'll see EDI reflected as a corporate project, as I just mentioned, in our strategic plan in order to develop a full and comprehensive work plan, which includes dedicated resources and investments required to move the work forward. Once the plan and resources have been established, EDI will then move under transformation programs within our corporate strategy, because this truly is about changing the culture of HHS. Recognizing that there are immediate EDI needs within the organization, we have prioritized work on a few key areas, including a working group that has been dedicated to the collection of EDI-specific data within our EPIC system during the patient registration process. We've also established a working group focused on reviewing and prioritizing our EDI policies, which includes the creation of new policies such as anti-racism, which has been drafted and is under review as we speak. We are also working on creating specific EDI training for leaders at various levels of the organization based on the required competencies identified in the recommendations of the report. This will then be followed by a full suite of training resources for the entire organization. Next slide, please. So it's important for us to keep in mind that this report may trigger additional trauma to those who have already been affected by the findings of this report. So I would encourage you all to seek support if you need it. We do have resources available on the Hub through our Human Rights and Inclusion page, our Shine Wellness program, as well as through our EFAP provider, Homewood Health. Links to all of these supports will be included in the FAQ that you will receive shortly after this town hall. And if you have any questions or concerns regarding EDI, please do not hesitate to send them to us. We would love to hear from you. Please send them to inclusion@hhsc.ca. So that concludes our next steps for the time being. But as I mentioned earlier, I do look forward to connecting with those who I haven't had the chance to connect with. So again, please feel free to reach out. Thank you. Rob, over to you.
Okay, thanks very much, Rochelle. I really feel fortunate and enthusiastic to have Rochelle and her expertise on board to help us navigate through this journey. So we're going to open it up to any questions or feedback. I want to say, this is a safe and supportive space, and I know that these are difficult issues. So uncomfortable questions can spark important conversation that, as Rochelle frequently says, that growth happens in those uncomfortable spaces. So I would encourage all of us to lean into this together. Dave, I'm going to pass it over to you to help moderate this portion.
Thanks, Rob. Excuse me, and thanks everyone for covering all that important material. So folks, anyone that does have a question, again, encourage you to type that into the Q&A feature, and we'll be happy to go through those and answer them live on this call. And of course, as you can see on the screen, if you do have any questions you would prefer to address outside of the call or out of this town hall, you can send them to hhsnews@hhsc.ca. One thing I will reiterate is a couple of folks, just if you didn't hear it or what have you, that there's been some questions around how do I get access to this information, to the full report, the report summary. So following the town hall today, there will be a memo that will go out to all staff, including links to this information, which will be available to everyone on the hub. So a great way to get access to all of the materials that have been discussed today. We do have one question open in the Q&A, so I will go through that now. So the question, and I'll read the whole thing. Is there any consideration for creating a permanent role for the Indigenous patient navigator at the General that is on site and available to respond to inpatient referrals in a timely manner? This would greatly support our Indigenous population. The JCC oncology patients have access to an on-site Indigenous navigator, but the remainder of the city of Hamilton only has access to one Indigenous navigator that does not work directly for HHS. If we are thinking about creating equity in patient outcomes, this would be a good step forward. Rochelle,
Okay.
perhaps you'd like to take that. Oh,
So maybe I could just, happy to have all of my colleagues supplement my answer or my comments. And so I see Rochelle is on board. That's great. Sharon Pearson may also want to chime in, but Sharon and I have been working with a group of Indigenous healthcare providers for some time now around a broader regional strategy for improving the healthcare experience for our Indigenous patients and providers. And so I think that's an important group. And ultimately, we're working towards developing a strategy for the whole of the region. We are in the process of hiring a person who will work full-time on this file to support the broader group. Again, I think that's an important step forward to have somebody who's going to be waking up every morning and thinking just of that. So, Indigenous peoples frequently say nothing about us without us. I think as we consider, what our approach to truth and reconciliation is going to be, we absolutely have to be doing that, working hand in glove with our Indigenous communities to make sure that they are involved. I don't think that means that we necessarily have to wait for that whole strategy to be finished before we make advances, just as we're making progress, I think, on the EDI front, even in advance of the final, all of the work that Rochelle is doing in developing a comprehensive framework and plan for us. So it's a good idea that's being put forward. So I think we need to consider it, but always in consultation with that healthcare providers group, Indigenous healthcare providers group that we're working with. Rochelle, I don't know if you wanted to add, or maybe Sharon wanted to add.
No, I have nothing further to add, Rob. I think you captured everything. Sharon, did you have anything?
I would just add that we're actually at the interview process, so we'll have this role in place shortly. And as Rob noted, it doesn't preclude us from moving along with other strategies internally as well. And we know there's always been amazing feedback around the navigator role at the JCC, and certainly we need to look at that across all of our sites. So I'm hoping we can get alignment with the work that's happening out of the Indigenous Health and Anti-Racism Advisory Committee and work with this new role.
okay. Thank you for that question and the answer from everyone. One comment has come in around, just the notion that some folks might not be comfortable asking questions that they can't ask anonymously in this forum, but would very much encourage anyone to send emails either to the HHS News at hhsc.ca, as I've mentioned, or to the inclusion@hhsc.ca, inclusion@hhsc.ca. Which is the inclusion inbox, and your questions will be treated appropriately and confidentially, and get your question to the right person to get you the answers that you're looking for. So I'll comment on that. Also a question around the report being available outside of the hub, and yes, the report will be posted to the HHS external facing website, I believe tomorrow. So those can find it there if they are looking for that. Do we have a means to capture, a new question here, do we have a means to capture comprehensive EDI data for our staff and leaders? Hi,
So,
Rochelle.
Hi, so I can answer that. So I appreciate the question. And we know that, data is a vital piece to being able to track and understand the current climate of our organization. So again, I'm about 2 months in the role, but I have been making connections with various areas throughout the organization to be able to understand what our current capacity is to collect data. And we are focused on that. That is one of our key priorities over the next several months from a patient standpoint. And we will also be focusing on collecting data from a staffing perspective as well. So, we have a lot of work to do internally as it relates to data collection, but it is certainly a priority for us and will be reflected in the EDI plan.
Yeah, there's a related question, Rochelle, which just more explicitly asks the question about collecting within Epic the information for patients, and I think you've just kind of covered that it is actively being worked on to ensure that we're collecting it, storing it, maintaining it, governing it, using it appropriately. But if you wanted to add anything further.
Yeah, I guess the piece that I would add to that, Dave, is that, and thank you for whomsoever asked the question. So we currently have capabilities within the system to collect data. So we are collecting data as we speak through my app, which is more patient-facing data collection. And as Dave mentioned, we do have a working group that is focused on the Epic side of things and working on a plan to be able to collect data upon patient registration.
All right, thank you, Rochelle. Another question here. Will the EDI Advisory Council's recommendation, oh, pardon me, let me rephrase that. Will all the EDI Advisory Council's recommendations be accepted?
So yes, as I mentioned, in my portion of the presentation, the work plan itself will be a reflection of the recommendations as outlined in the report. But it will also, that again is just one input. There are many other inputs that will also drive the work plan. So, but long of the short of it is yes, it will be reflected in the work plan.
Great, thank you for that, Rochelle. A question from the Hamilton, unfortunately I can't read the entire, there we go. The Hamilton Anti-Racism Resource Center. Will Rob's op-ed include the apology stated here today?
Yes, it will.
So thank you for the question, and thank you, Rob. All right, I'm not seeing any other questions coming in, and thank you for everyone answering the live questions. And also a reminder, if there are actually additional questions that you would like to ask, you can feel free to send them in to the email addresses I've already mentioned a couple of times, hhsnews@hhsc.ca or the inclusions@hhsc.ca email addresses. So always happy to facilitate those. I think we're moving now into the celebrations moment of our town hall today. So we would open up the opportunity to offer celebrations to either of our panelists, any of our panelists, pardon me, or if you have celebrations to offer, you should be able to type them into the chat function and we'll be able to see them there and share them with the rest of the participants on this call. So I guess we'll start with, are there any panelists that would like to offer a celebration at this time? Not seeing anyone come off camera or put up their hand, and we'll keep an eye on the chat function. Oh, there we have one hand. Let's go, Jay. Over to you.
Good morning. I just want to share that this week is Perioperative Nursing Week, and really want to thank all of our nurses that are RNs and RPNs that are working in our ORs to really provide care for our surgical patients. So happy Periop Week.
Happy Periop Week indeed. Thanks, Les, for sharing that. Okay, looking for other, I'm just going to ask to double check that the chat function is open. Not entirely sure that that technical feature has been enabled for this call, so I'm hoping that it will be. And in the meantime, maybe I'll just offer my own thought here in terms of a celebration, just celebrating this whole conversation, actually, the you know, in particular today about the EDI work we're doing here at Hamilton Health Sciences, and just sort of applaud the acknowledgement of the challenges and the intent, the clear intent to move forward, which is all that we can all do is go forward from wherever we are at. So thank you everyone for engaging in this topic. Hey, we got the chat function seems to be opening up now as well. So I will start to read out some of those. It's also Happy MRT Week, which both Janine and Karen Finley have put that in. So wonderful. Oh, and Neil Johnson as well. Lots of people know that it's MRT Week. And so, which of course is medical radiation technologists with a smiley from Karen Finley. So thank you so much for calling that out. Les, is that an old hand up? I'm going to assume it is for the moment. Okay, we're going to, yeah, the hand went away. All right, very good. We have also been reminded that today is International Inuit Day today from Stephanie. Thank you so much, Stephanie, for pointing that out. All right. Not seeing any more hands up, and I'm just going to double check the chat here, that sometimes it gets missed. Oh, we have one here. It is also National Patient Transport Week. Celebrate to all the portas across HHS. Absolutely. Without our porters moving our tests, samples, equipment, and patients around, it would be a very different world. And oh, we also have one perhaps that I missed somewhere in there, but a welcome to Rochelle. So excellent. All right, well, I think with that, folks, oh, did I hear somebody coming on camera? No.
Sorry, that was me. I was just saying thank you.
Oh, very good. Thanks, Rochelle. All right, well, with that, folks, why don't we, oh, one more here. Special thank you to all the HHS team members who have worked with HR&I on EDI issues for many years. Absolutely, this is not a brand new thing. Celebrating the HITS team for handling daylight savings time ending in Epic this weekend. Absolutely. I hate to remember what it was like when we were all approaching the year 2000. I think there was some trepidation around our first daylight savings. So congrats to moving through that. So with that, again, a reminder, if you do have any questions, you have email opportunities that'll be repeated on the hub. The materials for today's session, in particular, the EDI report and summary will be available on the hub and our external facing website. So I hope everyone has an excellent rest of day. Thank you for spending some time with us today. And I hope everyone has a good day and be safe.